Hi, I'm Jeff Todd, President and CEO of Prevent Blindness. Welcome to our Focus on Eye Health Expert Series. Today I'm speaking with Dr. Prem Subramanian, a neuro-ophthalmologist at the University of Colorado Anschutz-Rodgers Eye Center, on the topic of thyroid eye disease and mental wellness. Thanks for joining me today, Dr. Subramanian.
Thanks, Jeff. Happy to be here.
So you specialize in neuro-ophthalmic conditions. Can you explain what those are?
Neuro-ophthalmology is an area of practice that sits at an intersection between neurology and ophthalmology. So some of us, like me, are ophthalmologists, some are neurologists, and we take care of patients who have conditions of the eye or eye socket that affect vision, so they can affect the optic nerve, conditions like optic neuritis or other optic neuropathies. Patients may have double vision because they have problems with the nerves that come to their eye muscles or with the muscles themselves. Or they may have neurological conditions that affect the functioning of eye muscles, autoimmune diseases like myasthenia gravis. They may have strokes that affect their ability to see or their ability to move the eyes together or keep the eyes focused. And they may have chronic conditions like multiple sclerosis that can affect vision, both in terms of the ability to see as well as control over eye movements. And then finally, we take care of patients with tumors of the eye socket or the brain that can affect their vision, or neurologic functioning that affects vision. It's a really broad area, and it's one that is quite exciting and brings in people from different parts of medicine.
Working in the eye space, it's one of the most exciting things to me is that connection between the eye and the brain. And I don't think we think too much about how intricately those are connected. So thank you for sharing that. Today we're here primarily to talk about thyroid eye disease, or what we often refer to it as TED. Can you talk briefly about what that is and how it's associated with Graves' disease?
It's an interesting condition because you wouldn't expect that there is some kind of connection between your thyroid gland sitting in your neck and your eyes. But it turns out that Graves' disease, which at least 50% of people who have that will get eye problems from it. Graves' disease is an autoimmune disease where your body attacks the thyroid gland with antibodies, and it attacks a protein on the surface of the thyroid gland that happens to sit on a lot of eye socket tissues as well. And since those antibodies circulate throughout and are not confined to one part, they get into your eye socket as well. And when they get there, they can bind to that same protein on muscles, on fat cells, and cause changes within them, and also cause inflammation. People who have Graves' disease can get swelling around their neck or other parts of their body. In the same way, they can get changes in their eye socket that leads to thyroid eye disease. Now, interestingly, there's a small percentage of patients with thyroid eye disease that never develops Graves' disease, never develops the thyroid problem, which just tells us that we don't understand everything about this disease.
Got it. Thank you. So when you first diagnose a patient with thyroid eye disease, what are the first things that you explain to them about their condition?
Sometimes I'm the first one to tell them they might have thyroid eye disease because they don't carry a diagnosis of Graves' disease. So I tell them about that connection between the thyroid gland and the eye that I was just talking about. And then I go through the different things that patients with thyroid eye disease might experience in terms of the physical signs, the changes that can occur in their eye socket, changes to the muscle, changes to the fat, changes to the tissues around the eyelids. Now, they may already have some of those things, which is why they are sitting in my office. And I'll focus what I tell them based on what they're experiencing and try to help them to understand why their eyes or their vision may have changed with the thyroid eye disease. We then talk about how it's important to keep control over the thyroid gland itself. If they have the Graves' disease, the hyperthyroidism, getting proper treatment for that. We talk about lifestyle things, especially smoking, that can make thyroid eye disease worse. And then I think what's most important to any patient, but particularly those with TED, because they often were healthy before this started, is what the plan is going to be to address what's going on with them and to help my patients to recognize that this condition can take a little while to fully develop and then to fully treat, and that I'm there for them. We're going to work as a team to provide care and to help them to manage this condition, to keep functioning, and to give them the best outcome that we can.
So something that's particular to TED is the effects on the physical appearance of the patient. Can you share about what those effects may be and why they occur?
The physical appearance effects, I divide them into things that are more inflammatory and things that are more structural. So on the inflammatory side, a patient with TED often has pretty red eyes. Their eyes may look swollen. The surface of the eye may look glassy even. The eyelids can get red and swollen, and the tissues around the eye socket get red, swollen, and thickened. And all of that tends to happen because those antibodies recruit inflammatory cells, cells that normally are fighting infection. They come to that area, and so they release a bunch of chemicals that attract water and attract other cells and release other inflammatory chemicals that just build on themselves. And there's this cycle that leads to that really angry kind of look. And it's often very visible to people themselves as well as to others. And then those same processes lead to changes in the normal fat cells that fill our eye socket, and to the changes in the muscle cells of the muscles that normally move our eye. And those cells get larger, the muscles get thicker, and as a result, because your eye socket is a fixed space, it's surrounded by bone, it pushes your eyeball forward, and that's what gives that bulging appearance, or proptosis is the medical term for it. And the eyelids can appear more open too, because you have muscles in your eyelids to open them, and if they get tight, they can make your eye look even more prominent than it is. And then finally, if you get double vision because your eye muscles, the muscles that move the eye normally, if they get tight, your eyes can become misaligned, and that can be a visible abnormal appearance that can be very disturbing to people as well.
Mm-hmm. So relatively recently, we saw the first medical pharmaceutical treatment for thyroid eye disease come to market. And now we're seeing the potential for several others to join that as well. Could you speak briefly about what having a first treatment means for patients and for providers, and what the potential for many more is going to mean for the patient community?
It's opened a lot more options for taking care of our patients. So prior to a few years ago, we would sometimes treat our patients with steroids or with radiation, neither of which worked real well and had a lot of recurrence, and we had to wait for the disease to run its course. It would often quiet down after 2 or 3 years, which is a long time for a patient to wait. And even then, the bulging of the eye, the proptosis, the misalignment of the eyes didn't necessarily improve. So this one new medicine that's out there has shown some benefit for improving the bulging of the eyes, the prominence of the eyes in particular, and does have effect on the inflammatory stuff as well. Some degree of improvement in the other signs like double vision and such. So it's given us another option besides surgery, which was our main treatment to try to reduce the prominence of eyes, of eyelids, and realign the eyes. And I think the success of this drug and also advances in the lab have led to the development now trials for other drugs going after different pathways. So this one approved drug acts on a molecule in one pathway, and now there are drugs being developed, that some of them that are going to act more on the inflammation side, some of them that are going to act maybe more on the structural side, some that work in a similar way to the existing drug but might work better or might allow you to give it to yourself instead of an IV. So there are a number of options coming, and I think it's going to make our patients have a lot more to think about, but it will also help to address individuals, because one of the things we've learned in medicine over the years is that no one patient is going to respond the same way to a given treatment. And so having multiple options is going to allow me as a doctor to tailor things to my patients a little bit better.
Yeah, it's certainly a really innovative era in ophthalmology and pharmaceuticals right now, and the TED patients are definitely benefiting from that. So partly due to some of the conversations we've had with thyroid eye disease patients at Prevent Blindness, we've embarked on several different initiatives that raise awareness and provide educational resources on the potential effects that vision disorders can have on mental wellness. What are some issues that you've encountered with patients related to their mental health?
As I mentioned earlier, oftentimes these are younger patients. It's predominantly women more than men, and people who typically were healthy, didn't really have any other medical problems before this started. And so, not that men are not upset by how their appearance changes, but our society tends to put a lot more pressure on women in terms of their appearance. So that can really affect them because they just don't look the same. And if their vision is affected, and in particular, there's a small subset of patients that can actually lose vision from the disease, but it's more common that their vision is just impaired with things like reading, like using a computer screen, driving. And while they can do these things, it's a lot harder. And just again, getting through your day and having to struggle with things that should just come without any thought, that can really bear down on people. And so there's a lot of evidence that the incidence of things like depression and anxiety goes up in patients who have TED because they're just worried too. If I sit down and tell them, or some other doctor tells them, well, this is going to take a couple, 3 years, that's understandably going to concern them and make them concerned for their future. So it has a significant impact on their mental health in a number of different ways.
Absolutely. And we've seen that new survey data shows that roughly a third of thyroid eye disease patients would share about their emotional well-being with their physician at every visit. So why is it so important for patients to discuss their mental health with their eye care provider?
It's so important because I can't see that necessarily as I look at the patient. I'm limited to seeing things like, are their eyes bulging? Are their eyes red? Are they tearing? All of that stuff. And how is their vision affected when I measure it on the eye chart or do a visual field or something like that? But unless the patient shares with me that they're really suffering, that they are not going out as much because they don't feel comfortable doing that, that they feel like when they talk to clients in meetings that they're being looked at funny, or maybe they're not being as successful. If they don't share those things, those concerns with me, I don't have a good way of knowing what's important to that particular patient. I know overall that the disease affects people, but I can't really work with a given patient to help to address those specific things in each patient's life.
So we know that care partners play a really important role in any patient's healthcare needs. What recommendations do you have for how they can support their patient and be involved in their healthcare?
The care of patients with TED is by its nature team-based. The patient will see an endocrinologist, an ophthalmologist, maybe their primary care physician as well. And we talked about some of the mental health challenges that they might have. Getting a mental health team involved, whether it's just, again, their PCP, their friends and family, or a professional. And then there are a number of patient support groups on social media and live in given cities or regions. And my patients have really benefited from sharing their experiences with others who are experiencing those same challenges to their daily lives. And then finally, there are online education resources that can help them to learn more about the disease, about the biology of it, the progress of it, and the medical and surgical treatments that we offer them.
Well, as we wrap up, is there anything else you'd like to share today about thyroid eye disease or vision and eye health in general?
I think TED is one of those diseases that shows us how, when we learn more about a disease, how it develops and what we might be able to do to treat it, that suddenly we become better at diagnosing it, or we think about it more, and we find more people who have it who might benefit from treatment, because in the past, maybe we didn't look so hard because we didn't think we could do something about it. I also do research in some genetic optic neuropathies that affect people's vision in a very profound way. And there are companies developing treatments for that. And once they started doing that, all of a sudden, these patients that we didn't know about started appearing because they didn't think we could do anything for them. And now they were more hopeful. So I think that for me as a physician this is a great time to be able to participate in those things and to be able to help patients. And I just encourage people who are out there who may think that there may not be something that can be done for them to maybe take a second look, because a lot is changing.
Absolutely. And we certainly at Prevent Blindness have a number of resources around thyroid eye disease, as well as the intersection between mental health and vision health. For anyone watching, just visit preventblindness.org for more information. Thank you again, Dr. Subramanian, for joining me today. I really enjoyed this conversation.
Thank you, Jeff.